Patrick Burns, BBC Midlands Today at the West Midlands Government Office in Birmingham.
Well, the Health Secretary, Alan Johnson, has ruled out a full public inquiry into the deaths of hundreds of patients at Stafford Hospital.
A Healthcare Commission report published last week was scathing, describing an appalling standard of care there, with untrained receptionists in A&E carrying out medical checks and heart monitors being switched off.
Speaking on a visit to the hospital today, Mr Johnson said there was no need for a further inquiry as the Commission had already done the job of uncovering the failings. Here's Sarah Falkland.
Hand gel for the Health Secretary to stop the spread of infection. But the contamination from last week's damning report continues apace. A total of 138 MPs have now called for an independent public inquiry, something that seemed to be lost on the Minister.
About 130 MPs signing a petition is the first I've heard. There were just a few names on a petition. Look, we have made it absolutely clear that the independent inquiry was the Healthcare Commission. And the Healthcare Commission was set up precisely to be independent, to monitor these issues, to go in to get behind the statistics, and they've done their job very well.
So well, the hospital's chief executive, Martin Yates, has been suspended on full pay. His deputy resigned. So how bad was it? Well, the report said between 2005 and 2008, as many as 400 deaths could have been prevented. A lack of nurses meant that unqualified receptionists carried out initial checks on patients arriving at A&E. Heart monitors were turned off in the emergency assessment unit because nurses didn't know how to use them. And patients were dumped into a ward near A&E without care, so the 4-hour A&E waiting time could be met.
She was left in her own faeces and her own urine. It's things that will haunt me forever.
Ellen Linstead died in the hospital in 2006, left in agony on a bedpan. The Health Secretary says he's appalled at cases like hers. Despite insisting, though, there's no need for a further inquiry, he's now said that he's appointed Sir George Alberti, the National Clinical Director for Emergency Access, to carry out a 5-week independent review there. He ended his visit today by going to the cafe, which has become a campaign headquarters.
I think he was quite surprised at the extent of the problem. So I'm hoping now that he will take it away and draw on his conscience and give us this public inquiry that this community needs. We all need.
Well, today the Conservatives promised to help NHS whistleblowers. They say they want to put a stop to the fear many medical staff feel about speaking out about problems and appalling standards of care.
To tell us more about that, we're joined from Stafford by the Shadow Health Secretary, Andrew Lansley. In fact, rather appropriately, he's in the cafe, which is pretty much headquarters to the campaign to get action over the problems at Stafford Hospital. Thanks for joining us, Mr Lansley. If we can talk about Dr Mattu first. Good evening to you. Dr Mattu in Coventry, first of all, nearly lost his career, as you know, for speaking out. Can you tell us your plans concerning whistleblowers to encourage them?
Yes, I think one of the things that has deeply perplexed many people, including many who work in the NHS, is why so many failings could go on for so long, and there was so little evidence inside the hospital of people raising their concerns and having them listened to. So I want to make it absolutely clear that we can't tolerate a closed culture inside the NHS where people feel intimidated, where they feel that they can't raise concerns. I want to make it absolutely clear through the contracts everybody has in the NHS that they have a responsibility, not only professionally, but to the organisation in which they work, to raise those concerns. And if they feel they're not being heard within a hospital, then they should go to the Healthcare Commission or the New Quality Commission and have a hotline available where they can go and raise concerns.
There is a lot of fear, though, at the moment, isn't there? Do you think that will be enough, what you're doing, to prompt people to come forward?
Well, I mean, it is. I mean, just consider for a moment, in the airline industry, if something is wrong with an aircraft before it takes off, it is not a disciplinary offence at all, in any sense, to raise that concern. And even the most junior person is allowed to say, there's something wrong, we have to stop now and deal with it. What is a disciplinary offence in the airline industry is to know that something is wrong and not to raise a concern, not to make sure we learn from that and we stop it and we move on. And in the NHS, we need that culture. We need a culture that says, if something is wrong, be I chief executive, or the ward housekeeper. It is my job to make sure that we say, stop, we must put this right.
Mr. Lansley, thanks very much indeed.
Well, thanks to you too for watching.